Hi, everyone. I'm Dr. Arya Sharma, and I'm the Scientific Director of Obesity Canada. Obesity Canada is Canada's national registered charity dedicated to improving the lives of Canadians through obesity research, education, and advocacy. Through its work, Obesity Canada educates health professionals, supports researchers, mentors trainees and students, and works with policymakers to ensure that all Canadians living with obesity receive the same level of prevention and care as Canadians living with other chronic diseases. So today, we want to talk about some of the challenges that not just people living with obesity face in times of COVID-19. And we've already talked about the fact that obesity appears to be one of the main risk factors for people who get the coronavirus infection to experience complications. And so this is of special interest to us here at Obesity Canada, because obviously we all want to be safe. Now, we're very aware of some of the challenges that we all face in these times. And so it's a pleasure to be talking to Dr. Michael Vallis here on the show. And Dr. Vallis, he's a professor, is it now Professor Emeritus in psychology at Memorial University in Halifax. And Michael, welcome to the chat, and tell us a little bit about yourself and how you're holding up.
Awesome, thank you. Thanks very much. Okay, so I'm from Halifax. I'm a health psychologist, yeah, like most people, it's strange times. And I think maybe a good segue into our conversation is really, it's kind of stressful because, you know, normalcy doesn't really exist at this moment. And so I think we're all kind of struggling. And as a health psychologist, what I'm really interested in is understanding what people are experiencing, and in particular, helping people who are experiencing any kind of barriers, be them behavioral, be them emotional, be them relational, to overcome those barriers. And so that sort of locates us in terms of the conversation we're having right now.
So obviously, one of the biggest challenges that all of us have is this whole issue around social distancing, or maybe we should be calling it physical distancing.
Yes.
And I know that that's difficult for all of us at the best of times, but you know, what do you think are some of the key challenges that, you know, people living with overweight and obesity would face when it comes to social distancing or physical distancing that might be different from what all of us are experiencing?
Right, that's a really important point. And I think there will be several things that we would look for that would really be important for us. So I would ask us all to reflect on what has this social distancing done with regard to our relationship to food. So what's different about our relationship with food? I was just looking over last week, the US did a poll, the Harris Company did a general survey, and apparently 40% of the population are eating a lot of junk food, you know, social, using Netflix, and, you know, screen time has gone way up. You know, also preparing from scratch has also gone up. So I think what happens is that it's kind of changed our routines, and particularly around eating. And as a result of that, we need to then be open to understanding our behavior. So how do we explain, is there a difference in the way that we relate to food? The other issue really would be many people, and we know this from our research, that people living with obesity put a significant amount of effort into managing their condition. And so most of these individuals would be able to describe to you the strategies that they engage in to do as well as they're able to do. And now those can be interrupted. So if you're, you know, part of care teams, if you're pursuing physical activity, you know, this sort of healthy social eating, all of those things can be curtailed. So I think it's important for us to sort of ask, have things improved? Because obviously eating in restaurants may have been, you know, going down. So maybe in some ways it could be a little bit easier, but what ways might it be a bit more challenging?
And that very much reflects what I'm hearing from my patients. So when I talk to my patients and I ask them, you know, some are finding this actually a lot easier because they're saying they're not exposed to having to eat out, and, you know, even at the workplace, because they're working from home, they're not exposed to, you know, the goodies that colleagues might be bringing in. There's a lot less temptation, and there's a much more opportunity to actually, you know, do what we always tell our patients to do, and that's plan your meals.
Right.
because now, you can create your own schedule because you're sitting at home. And so there's a lot of my patients who are saying, well, this is actually great because it's helping me do things on my own time. But then there's the other folks who are saying, well, but now because I'm home by myself, or I've got the kids screaming, or I've got or I've got the double stress of having to work from home while looking after the kids, that is causing so much stress that now I'm actually looking for comfort foods and I'm finding it far more difficult.
Exactly.
So I think we have these two categories of folks
Yeah.
who are being affected very, very differently.
Yeah.
So now,
Which I think is that's a great comment you make, because one of the things that I'm starting to see now in the social media and even in some of the professional literature is people kind of coming up with, here's a strategy that will help you. And so the comment that you've made is so important, because what it allows us to do is say, look, everybody's different and we have to understand how it's affecting us personally. So just because someone else might be saying, oh, this is so much easier if you're finding it more difficult, then if we can understand your behavior, then we can help you to work with that behavior.
Now, one issue that has come up, and again, I've heard this from some of my patients, is that, with the start of the year, we had January and people were getting into new routines, and they were starting to make changes, and they were starting, maybe they got a new gym membership that they were very enthusiastic about. And, a lot of my patients also have peer support groups where they meet and they go for walks and they do all of those things. And now you can't leave the house anymore. So,
Right.
so that has kind of, thrown a wrench into some of those activities and those behaviors. So as the behavioral expert, what is your recommendation on how can you, what can you do to sustain some of those good intentions and some of those behaviors?
Exactly. Yeah, perfect. And my first comment would be to ask ourselves the question, what is the primary reason why someone could sustain behavior over time? And we know this from behavioral research that if the person is actually able to develop a plan they can stick to, so we call that adherence, and then they're able to develop the confidence to overcome the barriers, and we call that self-efficacy. And then as they go through this pattern, they start to find the personal, meaningful reasons to commit to these behaviors. That's the first. So all that you've described is really important, because this is the way that we can get our behavior started. In other words, you create a routine and the environment supports the behavior. But what's really classic about behavior, it won't keep it going forever. So if you say, oh, I love going to this gym because these people are so friendly, 100th time you've been to the gym, it's just same old, same old. So it may, the environment may not carry you less. So that's where we hope to promote these initiatives to get behavior started and then support the person as forward. So because obesity is a chronic medical condition like every other chronic disease, it really does rely on self-management. So I would ask any of us who are struggling and saying, oh, I was on a path that was working for me and now I've been thrown off, to just circle around again and ask ourselves, well, what can I do in the context that I have? And what are my barriers? And why is it important for me to keep working at this? And the only other comment I would make as a psychologist is to be compassionate and forgiving. And that is, if you find that, let's say your stress eating goes up because you're working from home and you're looking after children and you're trying to address all these perhaps with reduced income, then you need to really appreciate the impact that has. So I do think we can sort of encourage people to kind of bring into, so if you found something really, really helpful, how can you kind of resurrect that inside the walls of your home? And we've heard things like in Halifax, they're about to deploy a group of sailors on a ship for 6 months. So they put them all into a downtown hotel and they have to stay there for 3 weeks inside their hotel room. And a young woman last weekend ran a marathon between the door of her hotel and the window of the room.
Oh my.
And so there's a creative strategy for finding ways of moving within your own space.
So if there is anything positive about the lockdown, and I know there's not a lot positive going on here, but if there's one thing that's positive, and that is that you are now, people have the one thing they never have, and that is time.
Right.
And we know that, when you look at time or lack of it as one of the major drivers of obesity in society. People don't have time to eat, they don't have time to plan meals, they don't have time to exercise because you're so busy. Well, now you're stuck at home and now you've got all day to do things. And so what is your advice to people who are thinking maybe now is a good time to actually start a new routine, or get into cooking or get into meal planning or start making your own bread if you can find the yeast?
Yes.
So what's your advice for people who are now trying to change those behaviors and adopt positive behaviors,
Yeah.
and
So
get people started?
my first advice would be, what are you most interested in? So rather than looking around and saying, oh, these people are doing X, Y, or Z, so maybe I should try that. Just try to reflect it through your own nature of what your personality is. Would it be around food? Would it be around activity? Would it be around sort of socializing? And so what is it that you're most interested in? And it's kind of like that, we call it the path of least resistance. And then analyze your behavior and then sort of figure out for you what would be your next step. I find this quite important as a psychologist, because we sort of live in a society that kind of promotes go big or go home. So we tell these dramatic stories of the successes that people make. But when it comes to changing behavior, it's in fact slow and steady that wins the race. So we call it psychologically your next step. And that next step in your journey towards health is just a little bit closer to health than you are now, but not so dramatic that you can't sustain it for time. So I think it'd be a great opportunity for people to think about what are some of the things that they might be invested in and interested in. And then they can think about how can they keep that going when they're actually finished the isolation and kind of go back. Because remember, if you improve your health behavior during the COVID crisis and then you let it stay when the COVID goes, you'll drift back to where you were before, really, to kind of commit yourself to personal change.
Yeah. No, I like how you described the whole process as a journey. Very often we think, when it comes to obesity management, or, there's always goal setting, and the people set these goals and goals make it sound like, once you get there, you're done. When we all know that obesity, like every other chronic disease, actually needs long-term management. And if you're not enjoying the journey, then, whether or not you get to your goal or not really doesn't matter, because there is no goal. The goal is the journey. The goal is actually trying to enjoy the journey as much as you can every single day.
That's right. Exactly. And that's why we've been, it's been helpful in the psychological realm to separate out values from goals. So goals are something you aspire to get there and to achieve. But if the goals serve your values, so you want to be, let's say generally you want to commit yourself to long-term health because you're very family oriented and you want to be bouncing your great grandchild on your lap, then that you would set all kinds of little goals to keep you on that journey. But at the end of the day, two things. One, you're still always looking for becoming consistent with those values. Is this taking me closer to the person I want to be or farther away from the person I want to be? And those values also allow you to not have your goals met, because sometimes goals don't get met for no fault of your own. You do your best, but something happens. And so it allows you to have that, again, that compassion so that you can continue to move forward.
Now we are seeing a lot of memes online, and people are joking about the fact that staying at home is is causing people to gain weight, and we don't have any data on that. We don't know that that's actually true, but we do see the jokes, and we do see the the memes that are online and social media, which raises this whole issue around how as a society do we perceive the quarantine and the lockdown on health, and is this just reinforcing the idea that obesity is simply people who who are lazy, who are sitting at home, and who have no self-control, or or is this something that's far more complex than that? So when we think about that situation, what is your advice from a behavioral perspective on being judged, or fear of being judged, or fear of being judged once you go back outside again?
Yeah, I think you're absolutely right. It's a very interesting comment, and humor is a way of coping in a difficult time if you don't have control. But I agree with you. This humor is a bit. I'm concerned actually that it sort of does reflect a bit of a bias. because I think, in fact, that, what people are doing, what I observe is that, and you and I would probably both agree on this, the average Canadian generally lives a pretty unhealthy life. And individuals who live with chronic diseases often engage in much more health behavior than the individual
That's
who
true.
is quote unquote healthy. So in a way, making that kind of assumption that, oh, if you're just at home, you're going to kind of, blow up,
Yeah.
is actually a little bit of an assumption that we know is not true. And I
Yeah.
think you made a comment earlier, Arya, that was perfect, right? Because people are saying in some ways this is easier because I'm not exposed to all of that time pressure and those temptations and all of that sort of kind of mindless eating that individuals would go through during the day. So in a way, people's eating behavior is probably a little bit more reflective, which is actually a really healthy thing.
Yeah.
And so I think, in fact, it's a bit of a misnomer, and I do worry that it does reflect still this existing bias. I strongly believe that this bias against individuals living with obesity is really something that we have to take affirmative action on. And by that I mean we have to really go forward and be really clear and careful, and kind of not allow those kinds of things to happen.
Yeah, and I like how you just said that, when we look at people living with chronic diseases, very often their behaviors are actually a lot healthier than the general population because they're making the effort. When I
Exactly.
hear, when I hear, what some of my patients, the lengths that some of my patients are going to in trying to eat healthy and the amount of time and effort they invest into being physically active, and I look at my own lifestyle, especially now when
I
I'm
know.
stuck at home, I can only compliment many of my patients. I say, wow, I understand that you can do this, and thank God I don't have obesity because I don't know that
Absolutely.
I could do that. Uh,
Exactly.
so
Absolutely. Exactly, because you've just described the genetic contribution and the
absolutely,
environmental contribution of our current lived societies, and you've just maybe made the indication that in your case you don't have, let's say, that genetic vulnerability, so you've been able to escape without those coping skills. Those individuals who have that genetic susceptibility, they end up living with obesity. And interestingly, and I completely agree with you, and this is my career as a psychologist, I can tell you that as a psychologist for 37 years, you have tremendous respect for the people that you work with because they demonstrate such strength of character to focus, address their concerns. And it kind of is a little bit humbling when you're not in that situation and you perhaps are less capable than these people, these individuals would be.
oh yeah, I learn from my patients all the time, as I'm sure that you've
Yeah,
learned from me throughout your
absolutely.
career. So to
Yeah.
sum it up, if you had to sum up our conversation, with three important tips that people need to take away from this, what would those tips be? If you had to sum it up. Oh,
So what am I feeling? And the perception of threat, what if, produces anxiety. The perception of loss, oh, I really miss, produces sadness. And the perception of intrusion, don't let people tell you what to do, produces anger. So what am I feeling? How do I cope with it? And physical activity, physical calming, social support, expressing emotions, trying to reflect on values, those are very, very important strategies. And then how do I know if it's getting too much? How do I know if I'm at my limit? And we look at the level of distress. Is it really, really intense? Can you sleep? Can you concentrate? And how long it's lasting? Is it going on for more than 2 weeks? And is it interfering with your ability to function? And at that point, we would encourage you to reach out to a health professional to discuss mental health screening.
well, thank you so much, Michael, for taking the time this morning, and it was great talking to you in Halifax, and I hope you guys all stay safe. So to our viewers here, on behalf of Obesity Canada, I would like to thank you all for attending this chat. And if you want to find out more about Obesity Canada, please visit our website at obesitycanada.ca. You can also follow Obesity Canada on all of the usual social media platforms. And I know these are tough times, but they're tough times for everybody. So if you can consider making a donation to support the important work of the Obesity Canada, again, you can make a donation on our website. Thank you so much, and I'm sure we'll chat again soon.
Thank you, Arya. Bye-bye. Have a good day. Be safe.
Bye now.